So as you can see here, this is about the classifications of the cavity. Depending on the location of the dental caries, the classification will take place. We call them the cavity classifications. So cavity classifications or the location of the caries will pretty much same. As you can see here, we call them the class 1, class 2, class 3, class 4, class 5 and class 6 cavities. So these are the cavities which is present on the tooth surfaces on the base of the location of the dental caries. So what you can see here, this black spot, where it is present, which surface is present here?
Occlusal occlusal surface.
What is the surface?
Occlusal.
Occlusal surface.
Occlusal surface of which teeth? Anterior, posterior?
Posterior.
Posterior teeth.
Posterior.
And what about here? What is this surface?
Incision.
Which surface is this? This is the lingual surface. So lingual surface of central incisors, occlusal surface of posterior teeth. It can be premolar or it can be molar. So when we see the cavity or it caries on the occlusal surface of the posterior teeth or the lingual surface of the maxillary central incisors, that time this cavity is known as class 1 cavity. Now next picture is showing you here the dot, these black spots are the caries. Where you can see the black spot, what are the surfaces are involved here?
The buccal surface.
And what else? And what else?
Lingual surface.
Lingual surface. And what else? So as you can see here, this is the occlusal surface involvement. Then the mesial surface and the distal surface. Or you can do the buccal surface and the lingual surface. So it means that more than one surface. Here it is only one surface. But when the tooth cavity is present on the proximal surfaces, proximal means two surfaces, right? Mesial and distal. So the occlusal surface caries when extend all the way mesial or distal surface. As you can see here, the caries is only occlusal surface class 1. One surface class 1. Two surface or more than two surface class 2. That means the caries, it is gradually increase on the mesial or the distal surface. That time it is called the class 2 cavity. So this is also the posterior teeth. It can be molar, it can be premolar. So it means that class 1 and class 2 mainly for the posterior teeth and also the anterior teeth, especially only the maxillary central incisors lingual surface. Now class 2 and class 4, which tooth is this?
Anterior.
Posterior.
Interior.
So that is our anterior teeth. So as you can see here, class 3 in the anterior teeth, and that is called our mesial surface. That is the distal surface. So when the tooth cavity is present on the mesial surface or the distal surface, but not involving the incisal edge. So that is called the class 3 cavity. Class 4 cavity and class 3 cavity, only differentiating point is the caries is extending on the incisal surface. When you see that the caries is present on the mesial surface or even the distal surface, but it extends all the way toward the incisal edge, that actually known as class 4 cavity. Here you can see that between these two, one is on the proximal surface, but the incisal surface is intact. Because we know that for anterior teeth, it also have 5 surfaces, like mesial surface, distal surface, buccal surface, lingual surface, or you can say labial surface, lingual surface, and as well as the incisal surface. When you see that the incisal edge is intact, if you look at here, the incisal edge is intact, like that is called the incisal edge. That part is intact. There is no caries here. But here, as you can see, these are one of the proximal surface, and it involves the mesial surface and as well as the incisal surface. So that is known as our class 4 cavity. So class 3 and class 4 both are for anterior teeth, but only difference is in case of the 3, it will confine within the mesial surface or the distal surface. It can be like this also. If you caries can be see here, that can be also known as class 3. But it is not involving the incisal edge. Incisal edge or incisal surface is intact, that there is no caries. But while the caries is extending from the proximal surface to all the way to the incisal edge involvement, that time it is called the class 4 cavity. And that is also present only for the anterior teeth. Now the next is class 5. What you can see here? Anterior teeth and the posterior both are together. So it means that class 5 cavity can be seen in anterior teeth and the posterior teeth. What is the location? What is this
Cervical
location?
area. Cervical area.
This is called the cervical area. Very good. That is called the cervical area. Cervical area means if I draw a tooth here, cervical area means the portion of the tooth which is above the gum, that is called the crown, and that the portion which is below the gum, that is root. So this area is known as cervical area, or you can say the crown, neck, and the root. These are the 3 part of a tooth. So this one is known as our neck area or cervical area. So in case of the class 5 cavity, cervical area, both anterior teeth and posterior teeth are involved. That is called the class 5 cavity. Now the next is the class 6 cavity. It's a new classifications. So if it is involved, say as for example, if it is a posterior teeth, it is a posterior teeth as for example, if we can see the caries only the cusp area, not in the occlusal surface, top of the cusp area, or if it is anterior teeth as for example, like if the teeth is anterior, like incisors or canine, if the caries is only here, the incisal edges, that will be known as class 5, a class 6 cavity. So this is very important for everybody to memorize about the location of the caries and what we call them. We call them the cavity classifications. So class 1 means posterior teeth, class 2 means posterior teeth, but class 1 means anterior teeth also, but only in the lingual surface of the incisors. Which incisor? Maxillary incisors.
Sorry,
Because
can you
maxillary,
explain class 6
because
again?
maxillary incisor is the, I'm coming, because the maxillary incisor is the high lingual surfaces. When it comes to the class 2, it will be involve the occlusal surface and as well as mesial and distal surface. We call them the MO. We call them the MO, or we call them the DO, or we call them the MOD on the base of their involvement. MO means mesio-occlusal surface. DO means disto-occlusal surface. MOD means mesio-occluso-distal surface. So that can be the way we can explain depending on which surface is involved. Now, in case of the class 3, it is only for class 3 and class 4, they mainly for our anterior teeth. So in case of the anterior teeth, when you see that it can be canine, it can be, the lateral incisors, it can be central incisors. If you see that the caries is present only on the, the mesial surface or the distal surface, but not involving the incisal edge or incisal surface, that is called the class 3. And when it touches the incisal surfaces along with the mesial or the distal surface, that time it is known as class 4 cavity. When you see that the cervical area of the teeth, it doesn't matter which teeth, it can be any teeth, anterior or posterior. When the cervical area is involved for the caries, we call them the class 5 cavity. And in case of the class 6 cavity, it is only the tip of the cusp or the tip of the incisal edge. So it means that when you look for the posterior teeth anatomy, which we learned from our chapter 12, we talk about the cusp. Cusp means our occlusal surface, it is not the smooth. It has some, the highest point of this. These are called the cusp. So if we see any caries on the cusp tip, that will be our class, the 6 in case of the posterior teeth. In case of the anterior teeth, we know that this is our anterior teeth. So this will be our canine anterior teeth as for example. If we see that any caries here on the tip of the cusp, that will be known as our class 6 cavity. Okay, so that is very important, everybody, to memorize about the cavity classifications. Okay, is it clear for everybody? And because it is very easy in a sense, because we already know about the tooth surfaces. It is not the huge information, my dear students, for all of your understanding, because if you are not good enough for your tooth surfaces, definitely it is huge informations. But if you remember your tooth surfaces from your previous module, it will be one of the easiest way to know about this. That's the reason we are saying that once one module is done, it doesn't mean that the module is complete. You have to memorize the tooth surfaces. If you memorize the tooth surfaces from your previous module, here we just saying the involvement. If it is involved the occlusal surface, class 1. If it is involved the occlusal and as well the proximal surface, class 2. If it is involved the proximal surface for the posterior teeth, class 3. Not involving the incisal edges. If it is involved the incisal edge along with the proximal surface, class 4. If it is present on the if it is means the caries. If the caries is present on the cervical area, that is called the class 5. If it is present on the the cusp tips or the incisal edge, that is known as class 6 cavity. Okay, I think it's clear for everybody, right? Yes or no? So now, before that, we run this one because we want to talk about the composite filling materials. So let me go back here. Just give me 1 second. Okay. I want to go here. That will be easy for me. Okay, so this is about the classification which we talked about. Now the next filling materials is composite. So composite filling materials, which is a color match materials. Most widely accepted materials nowadays in the dentistry, choice of both dentist and the patients, because it matches the color. As you can see, it matches the color. So when it matches the color and it is aesthetically very pleasant, so patient satisfaction is more. With the new advantages, these materials increasing being placed in the both posterior teeth as well. So at the very beginning of the dentistry, it is used for the anterior teeth. Because when we talk, when we smile, we usually are able to see our anterior teeth. So that's why at the very beginning, that these materials is bound for the anterior teeth. But due to the advancements of the dentistry, it is also used for the posterior teeth as well. But the thing is that when you compare its capability of the strength of mechanical strength or compressive strength, it is still lower than that of the amalgam. As you can see here, originally it not as strong as the amalgams or gold restorations. Now designed to meet the specific needs of an area of the mouth of the tooth. So when you compare the the masticatory stress load bearing capability, that will be still more in case of the amalgam restorations. Now, what is the indications? Indications, as you know, that the composite filling materials, it can be used for any teeth, anterior, posterior, primary, permanent, it doesn't matter. But in case of the amalgam, the metal filling, we cannot put in the anterior teeth because canine to canine, this considered our anterior teeth. So we are not giving any restoration for the person who is coming for tooth filling. We are not giving any filling anterior teeth with the metal piece. If you give it, how it look like? It looks odd. It's not aesthetically pleasant. So that's why anterior teeth, we are not giving the amalgam restorations. But in case of the composite, it can go anywhere. It can go anterior, it can go posterior. It doesn't matter any big difficult or any problem. So it can go for anywhere. That's why I say the restorations for any tooth. Restoration surface defects such as the hypocalcifications, attritions, abrasions, congenital abnormalities, such as if the patient is suffering from any kind of developmental disorders, such as aminogenesis imperfecta, dentinogenesis imperfecta, or any kind of enamel hypocalcifications, we can apply these type of materials. Or any kind of
تصمیم گرفتن بعد از شام لیوانا و بوسچه شرابشون رو بردارن ببرن لب استخر دوتایی بشنن لب
please
استخر
stop your
شراب
mic.
بخورن و صحبت کنن اما دقیقا قبل از اینکه در خونه رو باز
Zahra, your mic is on.
Guys, make sure that when you are in the class, you should mute your mic all the time unless you are saying anything. So whenever it comes to the closing of the diastema, what is the diastema means? Is there anybody in the class? What is the meaning of diastema? Hmm? Do you know what is diastema means? We talked about this one before in chapter 12. What is diastema means? So diastema means the space between the the maxillary central incisors. So when we see that, because this one is our maxillary central incisors. So when you see the gap, so that is the mesial border of the central incisors. This is tooth number 1, and this is another mesial border, that is tooth number 2, 1. So if we see the gap between these two maxillary central incisors, the gap which is more than 3 millimeter, which is more than 3 millimeter. If it is less than 3 millimeter, it is not diastema. If it is more than 3 millimeter or 3 millimeter, or you can say 3 millimeter or above, you will see sometimes some patients, their maxillary central incisor have a spacing like that. So that actually known as diastema. That is known as diastema. So if the patient is coming like that, we can close this space like this. And this closure of the diastema can be possible by the help of the composite filling materials. That is another use of the composite filling materials. Then the next one is aesthetic recontouring of the teeth, such as the peg laterals. What is peg laterals means? Peg laterals means the lateral incisors sometimes come up as a conical shape. It is also discussed in chapter 12. So if we have any peg-shaped lateral, if we have any spacing between the maxillary central incisors, that need to be restored by the help of the composite filling materials. So these are the uses of composite filling materials, very important to remember for your upcoming final exam. This is very important. So everybody should know about the use or indications of the composite filling materials. That means it can be used any of the cavity we can use the composite filling materials because it matches the color. That is the examples, the pictorial presentations showing you the examples of the composite filling materials. And the next is the other expanded use of the composite filling materials is it can be used for any kind of developmental disorders such as hypocalcifications, amelogenesis imperfecta, dentinogenesis imperfecta, which also discussed in chapter 17. Then a closure of the diastema and the reshaping the peg lateral incisors, that can be also possible to improve their appearance through the composite filling materials. Now, what is the contraindications where we are not able to use the composite filling materials? If the patient with a high incidence of caries, usually it's better not to use the composite filling materials. If the patient has a history of the poor oral hygiene habit, not regularly brushing their teeth, so in that case, it can be a contraindication. The reason is it's a plastic materials. If the materials is not properly smooth enough, it can be able to catch the plaque on the tooth surfaces. And we already know that what is dental plaque and how the plaque is contributing the dental caries. So everybody should remember about this. So the tooth affected with the normal and heavy occlusal surfaces, and as well as the cost of the restorative materials is very high. So if someone is not able to cover the expense of the materials, they may be contraindicated for these, the dental filling materials. Composite filling materials is compositions. So what are the structures are present here? So there are 4 things are present here. One is called the organic matrix, which is called the organic resin matrix. Another one is the inorganic filler particles. Inorganic filler particles. Then there will be another agent which is make the relations between the organic and the inorganic substances, that is called the coupling agents. And there will be some pigments, that is the tooth color match material, because it is a color match materials, so they will be pigmented. So the pigments, coupling agents, inorganic fillers, and the organic matrix, these are the ingredients are present inside the composite filling materials as a chemical mixture. Now the next is, what are those mixtures? So resin matrix means they actually come in the form of a bis GMA, or we call them the dimethyl methacrylate. So these materials is used for the resin purposes. We say the resin materials which is used for in the plastic industry. But this material itself is not enough to apply the tooth structures as a filling materials. The reason is it is very viscous and it is not strong enough to withstand the masticatory stress. So that's why it is the fluid which is a monomer and used to make a synthetic resin. The synthetic in the industry, when the people are trying to make the resin materials or plastic materials, they use these materials. That is called the dimethyl methacrylate, or it also known as a bis GMA. So it is not enough, as I say, that itself, the materials itself, these plastic materials itself, not strong enough to use as a dental restorative materials. So that means that it needs some sorts of reinforcement so that it can be good for the dental materials to use as filling materials. So in additionally, it will add it will be come up with a mixture of some filler particles and as well the coupling agents, which combinedly takes place reactions, and that reaction is known as polymerizing reactions. So polymerizing reaction means the resin, filler particles, coupling agents, and the coloring agents, they all come separately and they stay together. But when we mix them or when we give them the light, they start to react to each other, to come together and make a strong bond. That is actually called the polymerizations. So addition of fillers and the coupling agents, that actually allow to happen this type of reactions or polymerization reactions will able to take place. Now, what is fillers? Fillers are the particles, which is glass particles, which actually apply on the the bis GMA or the resin composites, so that it can reinforce the what you call the strength of the materials. So the fillers such as the quartz, glass, silica, these are the small particles. They are also a form of the inorganic materials. So as you can see here, we have organic matrix, we have inorganic filler particles. So when the organic materials with the inorganic filler particles mix together, they will be increase their strength. And the only reason we add the glass particles in industry to make the composite filling materials to increase the the durations and capability of the materials as a restorative materials. Amount of filler, particle size, types of the fillers are important and to determine the strength of the materials or wearing and tearing resistance capacity of the materials. Nowadays, people are using the hybrid materials. So hybrid materials means at the very beginning of the dentistry, we are using the microfilling for anterior teeth and macrofiller we use for the posterior teeth. So nowadays, the hybrid materials which can be used for any anterior or posterior teeth. So on the base of the filler particles, they will come up like macrofilled, microfilled, microhybrid, and the nanofill particles. So these are the different types of size of the filler particles, which is combined with the restorative materials to make the composite resin restorations. So now what are those? As you can see here, these are the different types of composite filling materials which is available in dentistry, and as a dental assistant, we should know about all these informations. Number one is a macrofilled. Number two is a microfilled. Number three is hybrid. Number four is flowable. And number, the five is the sealant. So these are the types of composite filling materials which is available in dentistry. Now let's talk about the macrofill. That means that their particle size are the large. So largest of filler particle size which will be used in the composite filling materials, and that time it is called the microfill composite filling material because it is filled with the large particle size. It is self-cured. It is reacting to each other when they are going to soft permeable state to hard stage. In the other hand, the microfills, they are the smaller particle size and they are capable of producing a high finish surfaces. When we look for the high polish surface, we actually use the microfill because the macrofill usually unable to go for any high polish surfaces, and it will be give the more strength on the surfaces. Now the next is coupling agents. So the coupling agents, they will be used, they actually make a chemical environment or they're trying to help the organic and inorganic materials come together. It means that they are helping the resin and the filler particles come together. Before coupling agent, we discussed the the resin and the fillers. Resin are the materials which is viscous, but they are not strong enough to use as a restorative materials. Now the filler particle, these are the small glass particles which we sprinkles or embedded in these plastic materials. Now they need to come together, and by the help of the coupling agents, they will come together. As you can see, it strengthens the resin by chemically bond with the filler and the resin matrix. So when they come together, they will make the strong bond. So the adhesive test, the to adhesive this, to achieve this type of filler particles and coating with the organosealant compound. So sealants are the one which is the organosealant compound. The quartz, glass, and silica, they will come together. So that is the coupling agents. Now these are some examples of the composite filling materials. At the very beginning of the dentistry, we have a tube form of the composite filling materials, but nowadays we also have a capsule form. So capsule form is more commonly used nowadays because it can easily prevent the infection control. So hybrid composite is the most commonly used nowadays. It can become either a tube form or either a capsule form, it doesn't matter, but contain the mixed range of particle sizes. and the macro or microfill come together and can be polished with a smoother surface and highly polished, and it also gives the more strength. The reason it gives the two things because of the presence of the microfillers, they can be able to make very smooth surface. Because of the presence of the macrofill, they can be used for a high strength or high resistance around their materials point of view. Now, there is another type of restorative materials that is also the composite, but they are flowable. So flowable means they will be easy going process. They can flow easily. That's why it's called the flowable composite filling materials. By name, you can understand what type of composite is this. One is flowable materials, and another one is sealant. Sealant means, as you know, in our last presentation, some of you present about the dental sealants. So the sealants are the materials which we also use for on the occlusal surface of the tooth to prevent the dental caries. So the composites which only use for the sealant purposes, that actually known as the sealant composites. And the composite which is a little bit more thin in terms of the regular composite, they will call the flowable composite, because the flow is the key term for to describe this type of composite materials. Because sometimes we have facing difficulties to put the composite filling materials in the the inner surface of the tooth or the shallow space on the tooth. So that's why in that case we have to apply the flowable on that particular area, or sometimes it is very difficult to access on the tooth surfaces in some area, especially the interproximal areas or the close to the gingival areas is very difficult to reach with the regular composite filling materials. So in that case, we fill that part with the composite filling materials, which is flowable in nature. It supplies as either hybrid or nanofill composite, depending on the what ingredients are present, and it is enough to flow onto the surface of the tooth. The materials is designed to flow easily into the more conservative preparations. When there is a very narrow space preparations, conservative preparations, the flowable composite can be takes place over there to fill the restorative areas. Now, what is the applications of the composites? So, and what is the differences? The differences already we discussed that in case of the composite, first difference with the amalgam is the aesthetic point of view. When you see the patient as a metal filling, when the patient has a tooth color match filling, that is aesthetically more pleasant when the patient has more tooth color match materials. This is number 1 point. Second point is compressive strength, like the masticatory stress in the load-bearing area for the posterior teeth. It is better with the amalgam restorations, not with the composite filling materials. Even though we can apply the composite for the posterior teeth also. Then another one is the specific dental materials cannot be used with the composite filling materials, because composite is choosy. Is sometimes it is not go with the other restorative materials such as the zinc oxide eugenol, which is we very commonly use as a temporary filling materials. So that's why the specific dental materials cannot be used with the composite filling materials. But on the other hand, for amalgam, it can be easily go through with any of the dental materials. It is not choosy. Another thing is the retention procedures. So composite will attach on the tooth surface by the help of the bonding system. So it means that we have to apply some bonding materials. Before bonding materials, we have to apply some etch materials. So etching, then bonding, then composite. So that is the like 2-in-1 or 3-in-1 steps we have to follow. But on the other hand, as you saw in the video, the amalgam is just simply mix with the triturator, dispense it on the amalgam well, and then go to the patient's mouth. So it is very easy and convenient when you compare the procedure along with the amalgam. But the composite procedure, it is like 3 steps. First steps, we have to apply the in the etching materials, which is 37% phosphoric acid. So after wait for 10-15 seconds, we have to remove this etching materials by using the water, rinsing with the water. Then after that, we have to dry the surfaces. After drying the surfaces, we have to apply the bonding materials. So after apply the bonding material, then we will gradually put the composite filling materials increment by increment. Then if it is self-cure, they will react to each other. If it is light cure, we need to apply the light. So if it is dual cure, we have to give some time to react them, and then finally we have to give the light. So that's why the composite restorative procedures a bit complicated than that of the amalgam procedures. Now, another important thing is the shade selections. Whenever it comes to the composite, definitely we have to go for the shade selection. That means the color match. There are multiple color. We have like A1, A2, A3.5, A4, something like that. So as long as we are going more number, that means the teeth is more dark. We know that the normally teeth color is white, but some people teeth are yellowish white in color. Some people's teeth are a little bit dark or more deep, the dark, something like that. So that's why one of the most critical aspects is that when working with the composite is the shade selections. And always remember that the shade selection has to be determined before we start the work. So when the patient comes for composite filling materials, before we preparing the tooth cavity, we have to go for the shade selections. And there will be some kits are come with these selection procedures with the composite filling materials together, or the Vita shade guide, which is the universal shade guide. All over the world, we use that one. That is called the Vita shade guide. How they look like, that is the the color of the tooth. As you can see here, these are the different shades. People have the different shades of the color. Some people teeth are whitish, brownish white, or yellowish white, depending on the various type of the shades. So this is all about the shades all over the world. That is called the Vita shade guide. And these shade guides come up with the number like A1, A2, A3. So A1, A2, A3, 3.5, all those going up like that. So the tips when we are choosing the shades, as you can see here, determine the shades. It is possible in the daylight. And it is also possible to keep the, the surrounding area free from any kind of bright light. And we have to check this immediately, and we do not take delayed. So because make the choice quickly, always accept the first decision since the eyes being too tired after approximately 5 to 7 seconds. So it means that we take these shades out from the shade guide and we close to the patient's mouth and ask the patients to smile or to open their mouth. And we bring this shade guide close to their existing teeth, and then we can find out what shade will be, because this shade guide, they always come up with a number, and that number need to be matched with the materials which you are going to apply in the patient's mouth. Because here we have to make sure that the color is completely matched, because the patient here paying more money to match the tooth color filling material. So that's why it is very important to check the shade before we go for any kind of restorative procedures. They can be supplied in the tube form or the capsule form. So as I mentioned, that the capsule form is nowadays very popular in dentistry because it is useful for maintaining the infection control procedures. All these materials, they will become in the separate form, but they need to be combined together. As I mentioned, that the materials, they are very soft and permeable, because if it is not soft, if it is not permeable, so it is not possible to apply in the patient's mouth. In order to put it in the patient's mouth, we have to make sure that our materials is become very soft and permeable. So once we put them and once we adapt them according to the shape and size of the teeth, and once we satisfied about this shape and size, then we go for the curing. Because composite, once it is cured, it become rock hard. It become very hard. And we call them the polymerization is done. When the polymerization is done, then it is very difficult to change it. So that's why before we are going for the polymerization reactions by adding the light, we have to make sure that the materials is properly adapted, because in the amalgam we can adapt later after giving the materials, then we can shape it. Then it will be after a limited time, like say 3 to 5 minutes, it will be hard gradually. But in case of the in case of the composite, once the polymerization is done, we cannot do anything. So that's why before we are going for the polymerization reactions, we are adding the increment by increment about the composite filling materials, and also try to make the shape of the teeth.